The dark history of lobotomy. Have you ever imagined a world where the solution to mental illness was cutting parts of the brain? Have you heard of lobotomy? This technique, which promised to cure mental ailments, turned into a terrifying nightmare for thousands. Join me in unraveling the dark and fascinating history of lobotomy, a journey through time that challenges the ethics of medicine and teaches us valuable lessons. The beginning of research. In the 1930s, neurophysiologist John Farquhar Fulton made a discovery that would forever change the perception of treating mental illnesses. After removing the frontal lobes of two chimpanzees, he observed something surprising. The animals seemed free from anxiety and frustration, as if they had found the key to happiness. This finding was unimaginable. He had not only reduced the symptoms, but effectively altered the behavior of the primates. Fulton eventually caught the attention of the renowned Portuguese neurologist Egas Moniz, who was looking for ways to help humans overcome their own mental battles. Moniz began to envision a world where brain surgery could solve psychological problems. Imagine the hope! The mentally ill could find relief with a simple cut. But these medical innovations were about to cause more pain than healing. Moniz's theory. Moniz's approach was based on a very simplified theory about brain function. He believed that many disorders, such as depression and schizophrenia, were caused by fixed ideas in the neural fibers, connecting different parts of the brain, particularly between the thalamus and the frontal lobes. By thinking that disconnecting these connections could cure these ailments, Moniz initiated what he would call prefrontal lobotomy. The idea was innovative, but it did not prevent a series of unexpected consequences. Lobotomy seemed like a magic solution to many at the time. Moniz argued that the benefits outweighed the risks, but the lack of understanding about the long-term effects of this surgery left many questions in the air. The beginning of lobotomies. After conducting some experimental surgeries, Moniz became convinced of his success. He lobotomized 38 patients and in a hurried report claimed that 2/3 of them became calmer and relieved of their distress. His optimistic statements were met with enthusiasm by the media, and soon after he won the Nobel Prize. But there is a thin line between glory and tragedy. The practice of lobotomy was not only highly invasive, but also relied on a completely subjective definition of what it meant to be cured. From the medical perspective of the time, tranquility was seen as a sign of recovery. However, the growing acceptance and popularity of lobotomy raised ethical questions. The definition of what was considered normal in society was strict and self-centered. Many people with unconventional behaviors were institutionalized, and some did not have real mental disorders, being interned only for being considered problematic. A sad case was that of young Rosemary Kennedy, sister of future U.S. President John F. Kennedy. Her lobotomy, performed in 1941, resulted in permanent damage, incapacitating her from moving or speaking. What was believed to be a solution became a disaster that would mark her life in the history of medicine. Many other patients experienced the same tragedy. Changes in personality, general apathy, and cognitive deficits were common consequences of these surgeries. But the secret of their stories often remained trapped in a climate of stigma. The evolution of the procedure. In 1945, Walter Freeman transformed lobotomy with his transorbital version, a technique designed to be quick and easy to execute, allowing non-specialized doctors to perform the surgery in less than 10 minutes. This raised new alarms about ethics or safety. Freeman became almost a celebrity, performing operations in series. During a marathon at a hospital, he executed an impressive 228 lobotomies in just 12 days. But what does that mean? How safe is a procedure when done in a hurry? And who really benefits? The question was not only about the effectiveness of lobotomy, but its irresponsible implementation in an era that knew little about the real damages it could cause. Moreover, social pressure on these doctors influenced their decisions. Were they saving lives or merely rushing to comply with a protocol that led to irreversible damage? The legacy and lessons. In the 1950s, tranquilizers began to offer safer and less invasive alternatives to treat mental illnesses. Thus, lobotomy was slowly fading from the path of modern medicine, becoming a sinister reminder of the past. Lobotomy, which once seemed like a definitive solution, is now primarily seen as a symbol of abuse in psychiatric treatment. In the following years, movements for patient rights began to gain strength. The voices that were once silenced now cried out for rights and understanding. Today, lobotomy teaches us that mental health care must always be accompanied by compassion and respect. The lessons learned remind us that science and ethics must go hand in hand. What happened in the past must not be repeated. If you learned something new and surprising in this video, don't forget to leave your like and subscribe to the channel. Together, let's explore more important stories in medicine. As some may be unsettling, but all are essential for our understanding of human beings. Until next time, and keep questioning the limits of science.